think the first thing to say is that we're really sorry that families are having to wait longer than they should. We've had a huge increase in terms of young people who need to use our mental health services, and we're trying to see people in a timely way as possible. So to give you an example, our eating disorder service would usually see about 140 young people in a year. They've had a referrals of about 100 per month. So the enormity of the task in front of us is not something that we're taking lightly. As I say, we'd absolutely like to apologise that we can't see people as quickly as we would like to be able to do, but we're working really hard with our partner agencies to ensure that we will be able to make a difference to people's lives in the future. So our services have had a large investment into both Sussex and Hampshire. So for Hampshire, about £6.6 million will be coming into the service, and for Sussex about £6.3 million. That'll equate to about 200 jobs across both of our services that we'll be able to recruit to. We know there's real challenges in recruitment at the moment, and we will be recruiting to high quality staff who can offer the service that our families deserve. But it's not something that's going to change overnight, and it is something that's going to take longer than we would like. But we want to ensure that we have services which are fit for the future and which young people can be proud of and can get the best quality care that they deserve. So while families are waiting for access to our services, we know it's a really difficult, worrying and frustrating time, and it's not a substitute for face-to-face interactions at all. But we do have really good websites both for Sussex and for Hampshire. They are specific to those counties, and we update them very, very regularly. It includes top tips, but it also includes advice and signposting to apps that young people can use, and other websites that have been verified by our clinicians, but also where we've had feedback from young people that they've been helpful. So we would encourage people to use those websites, and we would encourage people to use them frequently, particularly if things change, because they will have been updated on the back of that. Well, I mean, the first thing for me is just a huge thank you. Our staff have worked absolutely tirelessly during the last 18 months. They've seen young people face to face where necessary, and they've seen people using our virtual platform. So we've never stopped offering the care that people should be able to expect. I know that some of our clinicians have gone to meet people in parks. I know that we've delivered things that people can use in their own homes, so art materials, so that young people can continue with art psychotherapy. I think our staff have continued throughout the pandemic to work as much as they possibly can for our families, and this is an unprecedented time. Our staff are going through the same things that people who use our services are going through, and it has been really difficult. It's been very, very challenging, but I couldn't have wished for any more. I'm so proud of what our staff have achieved, and I'm so proud of the people who work in our services.